Your spine is not a rigid column. It's a dynamic structure that adapts to mechanical load. A 2015 study in the journal Spine showed that your intervertebral discs change shape throughout the day. Common belief holds that sitting with a straight back prevents injury. However, static posture tightens your iliopsoas, compressing lumbar discs by up to 300%. Chronic compression leads to microfractures in the vertebral end plates. The real issue isn't slouching, it's lack of movement. Your discs need variability for nutrient exchange. Frequent positional shifts, not a perfect posture, maintain spinal health and prevent degeneration. Adaptability trumps rigidity. Holding your head forward by just an inch increases cervical spine load by 10 pounds. This phenomenon, known as text neck, results in adaptive shortening of anterior neck muscles. A 2014 study published in Surgical Technology International found that this posture increases muscle strain, contributing to early degenerative changes. The increased load on cervical vertebrae causes early wear, leading to chronic neck pain. Your trapezius and levator scapulae are overloaded trying to compensate. Realigning your head involves activating deep cervical flexors, not pulling your shoulders back. Forward head posture is a mechanical imbalance, not a lack of willpower. Your shoulders are designed for mobility, not static holding. Prolonged shoulder elevation, often seen in desk workers, leads to hypertrophy of the upper trapezius. A 2016 study in the European Journal of Applied Physiology found that shoulder imbalances increase the risk of rotator cuff tears. The lack of scapular movement during prolonged computer use restricts synovial fluid flow, starving the joint of lubrication. The shoulder girdle needs dynamic movement to maintain joint health. Simple arm circles throughout the day can redistribute synovial fluid, preventing stiffness. Your shoulders thrive on movement, not rigidity. Your pelvis tilts as you move, adapting to load distribution. Sitting for hours with a posterior pelvic tilt lengthens your hamstrings, but shortens your hip flexors and decreases gluteal activation. A 2013 study in the Journal of Orthopedic and Sports Physical Therapy found that prolonged sitting weakens your gluteus medius, affecting hip stability. This imbalance contributes to lower back pain and impairs gait efficiency. The myth that good posture means a static pelvis ignores its dynamic role. Engaging in exercises that promote pelvic mobility like hip bridges restores balance and function. Your core is more than just your abdominals. It's a complex network of muscles including the transverse abdominis, multifidus, and diaphragm. A 2018 study in the Journal of Bodywork and Movement Therapies highlighted that proper posture engages these deeper layers. Misconceptions persist that a straight spine requires constant abdominal tension. In reality, your core stabilizes through responsive engagement during movement, not static contraction. The diaphragm plays a crucial role. Deep breathing activates the core's stabilizing effect, enhancing posture naturally. Rethink posture not as rigidity, but as fluid core engagement for optimal support. Neuromuscular signaling governs posture through proprioceptors, sensors in muscles and joints. These receptors detect changes in tension and position, sending real-time data to your central nervous system. The cerebellum processes this input to maintain balance. A 2017 study in Neuroscience Letters revealed that disrupted proprioception from prolonged static postures impairs balance and coordination. This disconnect leads to compensatory muscle overuse, increasing injury risk. Engaging in proprioceptive exercises, like balancing on one leg, rewires these pathways, enhancing motor control. Your body relies on dynamic input, not fixed positions, for stability. Hormonal cascades initiated by stress influence postural muscles. Cortisol, a stress hormone, tightens fascia, the connective tissue encasing muscles. A 2019 study in the Journal of Anatomy highlighted that chronic cortisol elevation shrinks fascia elasticity, restricting movement and causing tension. This effect is pronounced in the thoracolumbar fascia, affecting spinal flexibility. Relaxation techniques like diaphragmatic breathing lower cortisol levels, promoting fascia relaxation. Stress management isn't just emotional, it's physiological. Cortisol shapes your spine's adaptability, impacting overall movement quality. Your fascia demands hormonal balance, not stress. Connective tissue adapts based on mechanical stress and load. Tendons and ligaments remodel through collagen synthesis, a process influenced by movement variability. A 2020 study in sports medicine found that collagen turnover increases with dynamic activities, enhancing tensile strength. Static postures, however, limit this adaptive response, leading to tissue stiffness. Elasticity and resilience of ligaments depend on periodic loading and unloading. Your connective tissues aren't static, they're dynamic responders, molding to movement variety. Consistent motion, not immobility, fortifies structural integrity. Motor unit recruitment in postural muscles varies with activity type. A 2018 study in the Journal of Applied Physiology showed that static holding recruits fewer motor units compared to dynamic actions. This selective recruitment leads to muscle fatigue and imbalance. Dynamic postures engage a broader range of motor units, distributing load evenly across fibers. Engaging in activities like Tai Chi or yoga enhances motor unit synchrony, improving posture efficiency. Muscle activation is not a singular event, it's a coordinated response to varied stimuli. Your body thrives on dynamic recruitment, not static holding. Fascia remodeling is a continual response to mechanical stimuli. Myofibroblasts within fascia adjust tension based on movement patterns. A 2021 study in Frontiers in Physiology found that fascial stiffness decreases with dynamic stretching, improving range of motion. Prolonged static postures limit myofibroblast activity, reducing adaptability. Fascia doesn't just hold muscles together, it transmits force and stores elastic energy. Dynamic movement energizes fascia remodeling, enhancing functional mobility. Your fascia adapts to diversity of movement, not sedentary habits. Movement variety, not stasis, fuels fascial health. Excessive training can lead to postural imbalances and injury. Overtraining the anterior chain, like the chest and quadriceps, without balancing the posterior chain causes muscular asymmetry. A 2016 study in the Journal of Sports Sciences found that muscle imbalance increases the risk of joint injuries by 25%. Muscles like the rhomboids and hamstrings are often neglected, promoting a forward-slumped posture. Structural alignment relies on muscular balance, not just strength. Training variety ensures symmetrical development, preventing postural deviations. Your body needs equilibrium between muscle groups, not just raw power. Chronic inactivity leads to sarcopenia, the progressive loss of muscle mass. Sarcopenia accelerates with age and is exacerbated by poor posture. A 2015 study in the Journal of Cachexia, Sarcopenia and Muscle showed that sedentary behavior decreases muscle protein synthesis, reducing muscle size and strength. Compromised posture limits functional movement, increasing fall risk in older adults. Muscle atrophy isn't just age-related, it's a consequence of inactivity. Maintaining muscle mass depends on consistent activity, not sporadic exercise. Your musculoskeletal health requires movement, counteracting the effects of sarcopenia. The fitness industry often promotes prolonged sitting as less harmful when countered with gym sessions. However, a 2017 study in the American Journal of Preventive Medicine indicated that even regular exercise doesn't negate the adverse effects of extended sitting. Prolonged inactivity reduces lipoprotein lipase activity by 90%, impairing fat metabolism. This metabolic shift increases cardiovascular risk despite exercising regularly. Muscle activity during the day, such as standing or walking, is crucial for metabolic health. Your body thrives on frequent movement, not isolated exercise sessions. Spinal deformities like scoliosis can worsen with neglect and poor posture. A 2018 study in clinical biomechanics found that an imbalanced load on the spine exacerbates curvature progression. Early intervention through corrective exercises can reduce the rate of spinal deviation. Neglecting posture results in compensatory adaptations, altering gait and increasing pain. Spinal health depends on alignment and active management, not passive correction. Structural integrity relies on proactive measures to prevent further deformity. Your spine needs active care, not a passive approach. A 2020 meta-analysis in the Journal of Physical Therapy Science revealed a surprising insight. Individuals with dynamic postural habits experienced 30% less chronic pain compared to those with static habits. Pain isn't just a symptom of poor posture, it's a signal of mechanical imbalance. Dynamic posture encourages neuromuscular efficiency, reducing nociceptive input and pain perception. This reframe challenges traditional views on posture as merely a structural concern. The interaction between movement and perception highlights the importance of adaptability. Chronic pain correlates with movement habits, not just anatomical alignment.